All right, let's get started. So this is a application from V Pharmaceuticals, and they primarily develop medication for people who have HIV. So if you all look into the proposal and you're trying to contemplate like how do you become competitive, well, the first thing you have to know is, what do you know about the funder? So just based on this application, what can you tell me about V Pharmaceuticals?
Well, we know that they're funding organizations that are already established that address HIV/AIDS areas and clients.
Yes. All right. What else do we know about them?
That they're interested in breaking the stigma and having the community involved, all while being innovative with how you utilize services and resources provided to those struggling with HIV.
Okay, good deal. Very good. Anyone else? What else you know about them?
They were specific with the areas in which that they cover and how the outcomes that they want from those who are interested in applying.
Yes. So this is a very important factor when you're looking to see who you're going to look for funding from. Now, a lot of you said that there's some grants that you've been writing over and over and over, and you want to figure out how to write different grants to different organizations. Well, this is the first thing. You have to learn what they want. You have to learn about the organization, see what they've been doing over the years. So when you start to do your writing, you start to conceptualize what you have to do, you're doing it from the point of view of the funder. You're not doing it from your point of view. So if it's Department of Mental Health, if it's going to be HHS, it doesn't matter. Always look at the funder, who's giving the money, and see who they funded before and what they like to see. How much money are they disseminating?
I think it said 250,000 every per year.
Okay, all right.
They
and
have,
how many? Oh, go ahead.
Sorry. From what I was reading, they have 2 grants that you're able to apply for. So one grant was 250,000 a year, and then you had another grant that was for 3 years.
Yes. And do they say how many organizations they plan to fund?
10.
How many?
10.
10. Okay. So if that was what, 250,000 times 10, 2.5, then they have a year span. Now, this is where I kind of have to make really great decisions. I have to kind of know who this grant is for before I write for one that has 10 or one that has just 1. So how competitive it is going to be pretty much based on how many people can actually be funded. So if you have a grant application that's going to take you, I don't know, a month or 2 to get together, and it's 80, 90, 100 pages, and they're only giving away 2 awards, you need to make sure that you are the one that they want to give it to, versus spending your time trying to get something that you may not qualify for, and it may just take a lot of energy and make you pull your hair out. So always look at how many people they're funding and where they're funding. And I think the positive action is pretty much in the South. And I know they're dealing with HIV. So I know that for our organization, we're in the South and we do a lot in HIV. So for me, this will be a competitive proposal that I will go for, simply because I know that I have such a deep and rich history in HIV, and I'm in the area that they want it to be in, that I will compete for this. But if they had maybe 1 or 2 awards, I probably wouldn't. But 10, I can deal with that. 1 or 2, I do not, unless it is something that I know that's very specific to the organization. So let's talk about, we talked about some of the goals and objectives. What are the overarching goals and objectives for this proposal? And you can pick either area that you want to look at, because they're 2 separate funding areas. But what's the overall goal and objective for those areas?
So they, the
What
focus areas,
page are you on? Amber, what page?
what page am I on? Okay, I'm looking on my phone, so it's hard for me to tell. I think it's page 2 on where they're talking about their focus areas.
Mhm.
So they're wanting to strengthen, the networks and the support system, link people and engage people in the community for treatment and care and whatever services are available, and advocacy to help them learn how to advocate for themselves and for insight and leadership for their own care.
Yes, very good, very good. Now, I would like to let you all know that if you write exactly what they say, you're not copying. You're not cheating. I know that we've been taught not to copy the words exactly. This is actually what they want. So you can frame these words, use these exact words as your goal and objective. There's no reason for you to create a goal and objective that doesn't match this. And it's okay. When they take the time to put these proposals together, they're anticipating that you're going to write what they wrote. So this isn't cheating. This is the proper thing to do. You see what their goals and objectives are, and you create goals and objectives that match theirs. You may have a little word change here or there, but it shouldn't vary too often and never feel like you are in the wrong because you are writing what they wrote. Who's the target population for this application? And when you find it, tell me the page.
I don't remember the page, but I remember reading it where it said, of course, people from the South, men and women of color, bisexual and gay men. And I think it listed something else. I'm trying to find it.
Page 1.
Say it again.
Page 1.
At the bottom.
What does it say?
Well, it mentions it at the top about where I'm at is kind of at the top where they're talking about, I lost my place. Youth, women of color, gay and bisexual men of color, people living in the South.
Yes. So now you know who you have to write for. So this is another thing about being competitive. They're giving you the populations. Do not veer. Do not add in groups that they didn't ask you to add in. This is exactly what they want. And if you're going to be competitive, make sure that you have access to the target population. If you don't have access to the target population, you need to partner with someone who does. So you can win this by first and foremost, understanding the goals and objectives of the RFP. What do they want to see? Secondly, you have to write for the people that they want you to write for. So now let's go to the pagination. When is it due?
Saw April on one and July on one, I think it said.
Yes. And this is the most important thing, as Belinda was saying. Things happen when you are in grant submission mode. The first thing you should really understand is, when is it actually due? Is there a time on it? Is it just due on a date, or is it due on a date and a time?
It just has a date on it. It doesn't, I don't see a time.
All right, good. There's a difference between 11:59 Eastern and 11:59 Central. So you make sure that you pay attention to exactly when it's due and try to be ahead of it. Things happen in the middle of submissions all the time, and nothing hurts your feelings more than for you to put forth all this effort in writing and pulling all these pieces together just for it not to be submitted because you went past the due date. Page limits. Do we have any page limits?
I don't remember seeing any page limits, but I may have missed it.
Okay, this one does not have page limits because it's going into a system. And I'm going to show you all the system. If you look at your writing activity, your writing activity has the word limits on it. So where there may not be a page limit, there is a word limit. I would suggest that whenever you're writing for a foundation where you have to put the information into a system, go and look at that system to see the word count. Majority of the times they have very specific word counts and will not allow you to add in additional information. If you spend your time writing a huge proposal, and then when you have to cut and paste it to put it into their system, it hurts your feelings a little differently because now you have to cut it. Now you have to figure out which ideas were the most salient, which will make this great. But you may be down on time. It may be submission time, and you've written 1,500 words, but the block only is going to accept 500. That's a time crunch that I despise, in all honesty. I prefer to know exactly what the word count is and the page number at any given time to make sure I don't overwrite. Also, if they have a block that says 500 words and they have a block that says 1,500 words, when they say 500 words, what do you think that means?
500 words.
But in the sense of what is that saying to you? 500 words.
Short and sweet.
Short and sweet. Yes, short and sweet. Don't be bodacious. They just want you to answer the question. Now, if they give you 1,500, 2,000 words, they want you to be a little bit more fluffy. But if they say 500 words, that means that they do not have the time to read all of your fluff. They just want you to answer the question. And that can be easy for some, and that can be more difficult for others. There are some people who write around fluff. They like all the words. They like to build it up and make it do some extra things. But in all honesty, if they don't want it, do not give it. Give them succinct, concise messaging that they want and move on. So what's the funding amount? We got
Dr. Gibson, I have a quick question. So if there's a page limit and you're entering it into the system, should you, before you even get to writing it in the system, should you write it out first? That way you're not cut and pasting. You are going to cut and paste, you know what I mean? Mm-hmm. So you're not going to overthink it. Yes. You already have the words out.
Yes, please write it in another document. As a matter of fact, I sent you all the document that you all are going to use today to write. So yes, put it in a Word doc so you can make sure that it is good. And before you put it in the system, basically once you get to the system, all you want to do is cut and paste and drop information in.
Okay.
All right. So what are the two different funding amounts that we have?
All right, one is 250,000 per year. And I can't find the other one.
So they have the AMP grant, two different areas.
The AMP grant is a 3-year grant up to $250,000 per year, and then the Positive Action Community Grant, I don't see an amount for them.
Yeah, I think it's all going to roll in together. Mm-hmm. Yeah. Okay. So, and what's the performance period?
When you say performance period, do you mean the period where we get them, how long we have the money to show what we're doing?
Yes. Okay. Yes. So this is how long you're going to be funded. So there's going to be a budget year in every grant cycle. Sometimes it could be a year, sometimes it could be 6 months. So what's the actual performance period for this one? How long will you get this money, in other words?
One says,
it says 1-year grant on page 4.
Mm-hmm. Yeah.
Positive Action Community Grants may apply for a 1-year grant.
Mm-hmm. And then you have another one. AMP may apply for 3 years.
3 years, yes.
So that's important to know. That tells you how much money you're going to get. In my novice days, made a grave error, got the grant, $300,000 per year. So which gave me, it was 3-year grant, $300,000 per year, which gave me $900,000. Didn't quite read that right. Ended up with $300,000 for 3 years. So I didn't have 900,000, I had 300,000. Now, by the time we caught the error, we were towards the end of the 300,000. So now I had to go back and backtrack to be able to get through the next 2 years because we didn't read. So make sure you know your performance period so you can keep your money within that performance cycle. Read, and in particular with foundations, they're not going to come in like the federal government. They come in very simple. It's some of my favorite money in the world. It just eases on in. You get the whole check, you know, you're able to move on through it. But pay attention to that performance period because that tells you how much you should spend a month, how much you should be spending by the end of the year. Because again, with grants, the balance at the end of the year should be zero because you should have budgeted for everything that you knew that you were going to be able to do. What's the eligibility for this one? Tell me the page number.
It is on page 5 at the beginning. There's,
Yeah.
I think there's like 5. Being a 501 internal revenue service designated nonprofit located in the U.S. or Puerto Rico. Programs and support primarily to the persons or communities impacted by or affected by HIV in the U.S. You can't receive any more than 25% of your total operating budget in 2020 from this program already. And must be the same if you're the organization applying, you have to be the same one that's actually receiving the funds. You can't apply for another program.
Yes. This is key.
Implementations.
Please know that you are eligible before you sit down and spend a month writing 80 pages on a grant just to find out that you didn't qualify from the beginning. So you know you have to be a 501c3. And again, with this one, you have to already have your foothold in HIV. It doesn't look like you can just step into it because again, apparently they're going to ask you some questions to ensure that you meet the eligibility. They're going to ask for some documents that says that you are 501c3. They're going to ask about your organizational past to make sure that you actually work in HIV. You got to be located in the United States. They're going to ask you about your budgets. You know, how much money do you get? You currently get money from them and how much is it? And what's your actual budget? Does it balance out? So all these things will go towards your eligibility. So don't miss on this because again, it's a painful thing when you sit and write and you're not eligible for it. All right, so do you need an abstract or a cover page for this?
I don't think it asks for that, but I may have missed that.
Yeah, I don't think it's in it. Maybe in the actual system. What components make up this proposal? And tell me, when you see it, tell me the page number.
It's on page 4 where it says the core concept is 40%, the organizational capacity is 25%, impact potential 25%, and the project budget is 10%.
All right, good. And these components will change throughout state, federal, and foundation grants. But as you can see, they're basically saying the exact same thing. Your core concept is going to be your need. Your organization capacity is the same regardless of what funding source you're getting. The impacts, all these things are going to be the same throughout all grant applications. What attachments do you have to submit?
It doesn't look like you need an attachment. I
Okay.
don't see anything that says an attachment.
This is a case where all of the information regarding the attachments are in the system. So this is another reason to, as soon as you get a grant like this, go and register, log in, and make sure that you can see what all is going to happen within that system. And again, once we get to the end, we're going to look at the whole system so you can see how it actually flows. What are some unallowable costs? And when you find it, tell me the page.
Funding restrictions on page 5.
Mhm. So what don't they want?
A lot. It's all
Okay, so
It's almost a whole page.
here's a whole page of you can't do this, and you can't do this is important. You're gonna have the you can't do this page and all the grants. Please don't do this. They're gonna vary though between federal and foundation and state. Now with this one, because this is a pharmaceutical company, the very first bullet says that you cannot be what?
Organization owned
Mm-hmm. And by a
by
Healthcare professional.
yes. Okay, so when it comes to pharmaceuticals and healthcare organizations, there's always this thing about a conflict of interest. If you have the actual power to prescribe medications, it could be seen as if you are taking a bribe from the pharmaceutical company. Because mind you, though they're giving money for HIV, this is a pharmaceutical company, and doctors and clinicians have a different rule. They call it the sunshine rule. Basically, you have to shed light on whenever you get monies from a pharmaceutical company. If you are a doctor, you have to shed light on if you eat lunch with a pharmaceutical company. So anything that a doctor does with pharmaceutical, they have to share with the federal government, basically. So this is why that rule is here. They also don't want you purchasing the medication. And I'm sure that you all can probably understand, as a pharmaceutical company, they don't want to blur the lines. They don't want you to buy their medication to give to the patient, because now, again, that looks like you're bribing the patients. So if they give you this money and now you're selling their medication. So it can be a conflict of interest with that. They do not want you to, looks like building. They don't want you building anything. Now, construction and renovation can vary between all grants, but for the most part, none of them want you to construct something. They don't want you building anything. They don't want you renovating, in particular federal government. But the federal government is at a point, they operate, if you build it, it's theirs. And so since they can't take it, then you can't do it. So they don't want you to use their monies to build anything. You also can't use religion in this to say that someone doesn't get to get something. So they can't be biased. You can't be discriminatory with their dollars. All right. So what are some allowable costs? And when you find it, let me know.
Is this it on page 2? On page 2, it says something about community grants may request funding for general operating support, special event sponsorships, or project support.
Mm-hmm. Yes, you're a genius. You're doing genius things now. Yes. This is one of those things where it's not going to be spelled out. You have to understand how to read and write a grant proposal. You have to be able to read through the lines to see what they're saying. So they're giving you, this is what it can go towards. If that means you have to have staff to be able to do the program, you got to buy supplies to be able to do the program, as long as supplies are not medications, as long as your staff is not a clinician. So you have to balance out what's not allowable, which what has to happen with the program. All right, so any questions about what we've just done with this proposal? All right, good deal. Well, you all did excellent. So we're getting ready to move into the actual writing of this proposal and how all this comes together. So when you're trying to figure out how do you get started on this thing? So first thing you have to do is you have to have an idea. So when developing an idea for a proposal, it's important to determine if the idea is already happening. Is it happening local? Is it happening statewide? And why do you think that's important to know if it's already happening?
Need to know what's your competition.
Yes, you got to know who you're competing against. You also can figure out who you can partner with. But knowing who's out there is important to you winning this. Your ignorance in who is competing against you can tear you completely down. I compete against, everybody. And I'd like to go and know what they could possibly think about doing based on what their organization capacity currently is. And so that's how we're able to maneuver through a lot of these things, because we spend a lot of time learning about you. I learned about mental health. I learned about the health department, UMC, Jackson State. I learned about them all, because if it's something I think that they are going to write for, then I need to make sure that I create language that gives me the competitive advantage. If the similar program already exists, the applicant may need to reconsider submitting the proposed project, particularly if it's duplicate areas in the area, if it's going to be a duplication. The awesome thing about living in Mississippi is that there's so many health disparities. There's so much to go around. If you live in the South, you really don't have to worry about duplicating efforts, because we have so many people that are impacted with, diabetes, HIV, STDs, cancer. There is no health disparity left behind in Mississippi. Now, and that's a horrible thing on one end, but for those of us who write and who live off grants, that's how we make sure that we stay in the number, because we always have something to write for. If significant differences or improvements in the proposed project goals can be clearly established, it may be worthwhile pursuing additional assistance. And so with this particular proposal, you can write this and also look for other proposals that may match it. And so even when you do that, you can write that into this proposal that you've sought out funding from other resources to strengthen this proposal. Building relationships. Again, we want to be competitive, but at the same time, we want to make sure that we know who's in the environment and that we can work with them. So community support for most proposals is essential. This is when they're going to ask you for your letters of support. Do you have MOUs? Do you have MOAs? Are you working with the institutions? Are you working with the academics? Are you working with the health department? Who do you work with? This is not something that should be established or thought about in hindsight. You should know your partners now. You should know who you can get letters of support from now. There are going to be some applications you're going to apply for that letters of support are mandatory. And so if you haven't made friends with anyone, you won't be able to get letters. I don't like getting to the very end of a proposal and realizing that we need 10 letters of support and we have none. And now you got to go and hustle to find who's going to write you a letter. And then there's some organizations that they'll write you a letter, but their board has to meet first to approve the letter being written. There's sometimes they have to get the MOU or the MOA approved by the board first. So if you have a proposal that's due and the board doesn't meet until the week after you have to do it, that's not going to work for you. So make sure that you keep your relationships working. And so you have a grant that you're working on. it's nothing wrong with go ahead reaching out to the people that you want letters from or MOUs and say, hey, I got something coming through. I may need a letter of support. And I like to write the letter of support myself and send it to the agency. No one can talk about me better than me. And you don't want errors. You don't want the messaging to be incorrect. Now, of course, they can look at the letter and make changes they want to make. But if you want it done and you want it given back to you in a timely manner, do not expect someone to write your letter of support for you. I'm not writing letter of support. You send me letter of support, I'll read through it and I will sign it. But they don't have a lot of time. No one has time to write your letter of support. So if they make sure that you pull those pieces together, know who you're going to ask for, and you can also just have a standard level of support already ready that just needs information added to it. But most definitely, don't ask people to write your letters. Try to get your letters yourself and send it to them. Now, there was a question about one person having to write an 80, 100-page application. There are 3 different ways that you can write. And the first one is going to be a solo writer. This person is going to function in all the roles in the grant writing. This is a hard job. But if you are, if you're good at what you do, if you can see the vision and you have the time, you can be a solo writer. I was a solo writer for years. I pulled all the pieces. I got the budget together. I did all the components myself. Then you can have contributor writers. So this is multiple individuals with the same role. So if there's going to be, let's say someone's going to work on the ancillary pieces, you get people to work on the budget, the levels of support, but you stick with the actual application. So you're going to write it. You may get other people to help you with just the support pieces. And then we have team writing. This is multiple individuals with different roles. And so in our grant writing process, we have 4 separate roles. We have the lead writer, the evaluators, the support team, and the editing team. So the lead writer is going to be the person who is going to conceptualize that proposal. They're going to see it from A to Z. And in grant writing, even if you are a beautiful writer, you have to be able to see what happens in a program from the beginning to the ending. This is going to be from how you're going to hire, how you're going to recruit, the services you're going to provide, how you're going to keep up with the services, how you're going to evaluate the services, and how you're going to spend the money. So it takes someone with the capacity to see the whole picture. Then you have your evaluators. All grant applications are going to have evaluation section. It can be a cookie cutter section that you can move from grant to grant, but you need someone to be on the evaluation team to see how the objectives are going to be written. How we're going to make sure that if we said that we're going to work with 35 people, how do we document those 35 people? And then you have your support team. Your support team is going to be your letters of support, your budget pieces, getting your 501c3 letters together, whatever attachments that have to go along with the grant, someone else or another group of people can actually pull those things together so the lead writer can really focus. And then we have the editing team. The editing team job is basically to read what you write and compare it to the scoring to tell you how many points do they see us actually getting. So to win the proposal, you have to have the most points. That's generally how all of them work. So if you have these functions going on where you, as a lead writer, you don't have to worry about the budget. You don't have to worry about level support. You don't have to worry about the editing. You don't have to worry about the evaluator. You can be pretty free to write. And I think you get better proposals. I mean, I was an awesome solo writer, but you lose hair as a solo writer. Yeah, it wears you out. You drink all the wine as a solo writer. Because you're going to be tired. The team writing, it helped to grow me as a writer. It helped to grow me as a leader. I came up with this team writing piece because I spent a lot of time being angry because someone couldn't pull a piece together, couldn't write something, couldn't do something. And I took a step back. Instead of me being angry about what they can't do, how about I appreciate them for what they can do? And so instead of putting someone in the role of lead, maybe they're better at support. Maybe they're better at editing, but this is a skill set that everyone's not going to have, but it's not something that everyone can't participate in. Figure out what the team members do best and put them in those sections. And that takes the stress off of you and takes the stress off of them. And you have a much happier grant writing team. All right, so we're getting ready to start preparing this application. Take you about 10 minutes to get yourselves together. You're going to be put into groups, and you're going to, if you have your phone or laptop or whatever it may be, you're going to have to do some Googling to find some answers, and you're going to have to work with your team members to write up some pieces. You're also going to report out what you wrote. So get yourself together, get you some water, get you a piece of candy, a cake, a cookie or something, because this is going to be the bulk of our day, and this is going to be the longest point. All right, we're going to get started. So we're going to start preparing this application. So we have three main areas that I like to break any grant application into, and that's going to be the beginning, the middle, and the ending. And we're going to talk a little bit more about the middle than any of the other sections. All right, so with the beginning, and this is basically like the pieces that make you whole. You know, when you're working with the federal government, they have all types of assurances and sources. You know, they want to make sure that you are a legitimate organization. And so this is beyond your 501c3 process. This is, do you have a DUNS number? Are you registered with the federal government? They want to make sure that you've done all the proper paperwork. And that's pretty much just with them, maybe with the state, but for the most part, this is signing of assurances is going to be a federal process. Most of them want a cover page or a title page. This can be embedded in their system, or it may be something that you have to add in. So it just varies, but this is one of these things you have to really read to make sure what they want and how they want it. Abstracts, that pretty much is across the board. There's short, brief synopsis of what you've already written. Your abstract is going to be written last because you want to make sure that you have all of the components that are present in the proposal that you have written. It's not a long thing. It's going to have, most of the time, going to have a word cap. It's very simple. However, it does require you to make sure that you're at the end of the proposal so you can put in the purpose, the objectives, and the outcomes. So when we think about the meat of any grant proposal, it starts with the need. So the need is a well-documented description of the problem to be addressed, need, and why it is important. Now, let's be clear. All things that may be a problem to you or to someone else may not be deemed as important. This is going to be based on what the funder's view of importance is. It should establish the significance, the timeliness, and the general allowability to it. And credible sources should be used for all statistics. You should document, this is where I got this information from. So with your needs statement, it has to be something that comes from someone else. Now, this is where we get into the, copying what someone else has said or done. Now, because you're not the health department, you're not the federal government, you don't have your own stats. Now, you may have some stats within your organization. We have some stats in ours, but for the most part, they want the needs section to be documented from other sources. Someone who can validate that what you're saying is a problem. Someone who can validate and say, not only is it a problem, it's an important problem. It's something that we really need to tackle. So when you're looking at your needs statement, these are things you're trying to consider. What is the problem? Who's affected by it? What is the impact of it? And what are the implications to the community? So first you have to figure out what's the actual problem. Now you might read this application and think that everyone's going to come up with the same problem. They're not. When you read these applications, you see something, I may see something totally different. Now, we're both going to respond to the funder the way that they want us to, but it doesn't necessarily mean that we have identified the same problem. Who's going to be affected by it? We talked about the target populations. There are multiple target populations. You may decide to focus on bisexuals. I may decide to focus on HIV positive women. But again, so our proposals won't be the same. And what's the impact of it? I mean, if you're thinking about what currently happens to women when they're HIV positive and they're pregnant, what happens in the healthcare system? But then when you turn the table and you see the LGBT community and how they're impacted, what happens to them in the healthcare system, you'll be able to find the information showing how each of them are impacted, but they're going to be impacted differently. And what are the implications to the community? What happens if we don't fix this? What happens if we don't address it? What turn of the table? I mean, we have so much stigma, in particular around HIV. If we don't handle the stigma, we don't address the stigma, stigma has a way of ensuring that people don't take care of themselves. Stigma will put a person in a position where they'll be so afraid or so concerned with how someone else views them that they will not take their medication. They don't want to deliver to their home. Stigma will stop a person from going to the doctor because they don't want to be seen in a particular area. So what happens to the community when you have people who are not taking care of their HIV? You have people who are not getting on PrEP. That means that we will continue to have transmission of HIV and acquisition of HIV. So this is what's going to happen to the community. And so you have to make this case in your needs statement. So you all have a document. Make sure you get the name of it. It is writing activity. It should look like this. So pull that document up. All right. So we're going to get started with actually doing some writing. So you all have read this a little bit, got a little familiar with it, but you understand pretty much the gist of what they want to happen. You understand there are a couple of different areas that you can write for, but for the gist of it, you know, you're writing for project support. And they give the things that they want you to do. If you're expanding a project, if you're creating a project, whatever it may be, but these are the areas that they want you to address. So you all are going to get in your groups and you're going to talk about what you want to do, figure out who's the problem, what the issue is, who's being affected by it, and you're going to put pen to paper. So you're going to be put into 3 groups of 4 and 5. And once you get in your groups, I will come in to check on you and see if you have any questions. But you're going to start with that core activity sheet that you have, and you're going to start with the first section and you're going to look up the need. Welcome back. Look like you all had an awesome time. Well, we're going to get ready to report out. So what I want you to do is to tell me who you're working with, what program you're going to do, and what the need is. So we can start with group 1, room 1, which is the room with Melinda.
Okay, let me get back to my screen.
All right, look at you. I look like you all have done an awesome job. I can't wait to hear it. I can't wait to hear it.
Okay, we're group 1, in which we decided to write the problem need from the AMP grant, in
Okay.
which our problem, of course, HIV rates continue to disproportionately affect African American, gay and bisexual males within the South, specifically Mississippi. With regards to who's affected, we did search online and found that according to the CDC, most HIV diagnoses are found in gay and bisexual men. And according to the Mississippi Department of Health, in 2017, Blacks or African Americans counted for 43% new cases here in Mississippi. So it's quite a need, and it's very significant that we, of course, write this grant. With regards to the impact that it has for Mississippi, of course, health literacy levels are at a lower level. Of course, the lack of treatment with regards to accessibility due to one's location within Mississippi And again, it's and with regards to implication, of course, the level or the knowledge with regards to health literacy, it declines as most individuals who are diagnosed, they don't have the knowledge or the understanding to know how to get treatment or how to access treatment or finding the right doctor with regards to getting their needs met. Of course, again, not having the knowledge to know, look, safe practices, which also may spread more infections without this accessibility. Of course, it can affect the healthcare sector with regards to the whole dealings with stigma, etc. And as far as the closing statement, what we came up with was that the impact of HIV occurs in urban areas of Mississippi with African Americans continue to have a disproportionate rate that affects their whole entire life.
Yeah, very good, very good. Because ultimately, this the morbidity and mortality. People are going to die. Yeah. I mean, at the very end of the day, if we don't catch this, the ultimate implications for the community is that they're going to die. And so that was good. So what type of program are you all going to do? You focusing on mental health?
Ma'am?
Are you focusing on mental health?
We didn't really
Yes.
get that far.
We didn't like that.
Question.
Hey, look, you know what? I can know overachievers when I see him. Like, hey, you all right? Okay, let's go to group 2.
HIV. We looked at AMP grant HIV.
Okay, all right, I got you. Okay, next group 2.
That's us, isn't it?
Oh yeah, and I'm a professional facilitator. I'll wait all day on you. I won't say a word. So hey, don't.
Oh, we group.
Oh yeah,
We're
group 2. Yeah, I started doing something else.
I didn't know we were group 2. We group 2?
Yes, Patrice. Group.
Yes,
Yeah, you're
that's
group 2. Mhm.
Okay, Yolanda, come on. And Amanda.
Okay. Well,
Oh.
we kind of got our target was we're looking at youth, the sexual health education in terms of HIV and of the youth in Mississippi. We didn't get very far in terms of like the write-up because we kind of got stuck on trying to find current information
Mhm.
in terms of doing the background. So that was
Okay.
our biggest problem. Like we found data, but what's too old to be considered relevant.
Well, it varies. There are gonna be some things that just don't change. So you can pull some things from way back and it's going to be relevant. I mean, how
Okay.
HIV is transmitted, that is 100%. Doesn't matter when it comes out, when it's public, it's a known fact. When you start thinking about data as relates to populations, you want to stay as current as you possibly can. But technically, you can go back as far as 3 or 4 years, and particularly if it's been a stable kind of thing, you can go further back. Yeah. And with the youth now, I'm surprised. Were you looking at youth in Mississippi?
Yes.
Just,
Okay.
well,
Or
I
the youth in
wasn't.
the
I
United
was
States?
at the South in general.
No, in Mississippi, and I found some information, but it was like from 2014, 2015.
Okay, yeah.
Now I found, that said that, even though we're a small part of the overall population, the southern region, that HIV/AIDS is growing astronomically in the state of Mississippi. And then with the youth population in particular, that population is usually the population that, as Ms. Patricia said, that more deaths occur. Because it's
more new
going
cases too.
Yeah, more new cases.
Yes.
That lead to death. So because they're not, I guess, getting proper treatment and they're engaging in more high-risk
Risky.
activities.
Yeah,
What did you Google to get the information?
you found some of
Um,
CDC
Some of the CDC, and mine came from CDC.
and the
Mhm.
health department.
Okay, all right. There is some more current data out there, and let me ask you this: what was the exact statement you Googled?
For me, it
Well,
was,
see, we
um,
divided it up,
yeah.
June, like, one of us was going to look up what is the problem. One of us Googled, who is affected? What is the impact? All of us, we divided all of that up. So all of us was looking up different parts of
Okay.
the need statement.
All right, let me see. So that information should be ready and available. I'm looking to see what you all encountered when you went out there to look for it.
Mhm.
Yeah. So there are some articles, and let me go back. Go back. Okay, well, let me go back. That can I can't go back for some reason. Hold on.
One of the articles that I found while you're looking for that was HIV and youth prevention challenges.
Mhm.
And it's the part that I was focusing on was the inadequate sex education.
Yes. Yes.
And
I saw that.
you see
Yeah.
that? Did you see
Mhm.
that? And it was the CDC's 2018 school health profiles.
Mm-hmm. Yeah.
And it was
and that-
talking, yeah. That's the part that I was gonna try to use.
I'm looking to see what. Okay, this is giving us something. All right, so in this particular case, HIV is going to be probably one of your most current data that's going to be out there. And it may take a little digging, because again, I'm already up to 2018 where it's going to break it down, but it's going to be some of your more current data. But you have to keep digging, because 2014 would be too far back, because the numbers have changed since then. And when you define youth, and this could be the issue too, defining youth is what are you saying is youth? How is youth being defined?
That was an issue that we wasn't for sure about, like what ages, because a couple articles I read was said from 12 to 17,
Mhm.
but then one article said under 18, and then another article that
Said
another
to
member,
25.
25
Yeah.
to
20,
so
yeah.
what's
It varies, and it's based on your capacity. Can you get to 12-year-olds? Can you get 12-year-olds in your program? Do you have access to 12-year-olds? Or do you have access to 20-year-olds? So the age range for youth can go from, it's generally going to be between 13 and 27. And so
Okay.
you can segment that population out to be able to figure out who you have capacity to work with. I do not have capacity to work with 12, 13-year-olds. I have capacity to work with 18 and up. Again, because again, with the work that we do, I got to get parent consent if they're a certain age. And I'm talking about sex. And no one wants to believe that little girls and little boys have having sex. So I don't want to be the one to tell them they're having sex. They have to come to
Turn
me.
on the light.
Yeah. So no, I work with grown-ups. I work with adults. I know you're having sex. But again, it's who you have access to. And then with the way the data is written, you can write the story that you want to write based on the age group that you're working with. So when I have to write youth grants, I end up picking up the whole 13 to 27, and then I'm able to segment them out, because there is data that's just going to say 18 to 27. So the data is broken up in multiple ways for a reason, and that's okay. It gives you the leisure to pick who you want to work with. All right, good. Well, you all did go and find something. I saw you framing up the discussion of what should be said and how it should be said, which is good. Okay, good deal. Let's move to group 3. Who is this? Christy, Yvette, Shantoya.
Okay, I guess I'll go then.
Oh, sorry.
Go ahead, Shatoya.
I was okay. So we decided to focus on African American women, adult women, mental health and HIV. So our project is called The Healthier You, and it's designed to focus on increasing access and awareness of the mental health needs of African American women 18 and older living with HIV. The Healthier You project is designed to focus on increasing access to and awareness of the mental health needs of people living with HIV. This project will provide individual and group therapy to all participants. We will establish collaborative relationships with local medical providers and shelters for continuity of care. Lastly, the project will provide support groups for family members of loved ones of those diagnosed with HIV. The Healthier You project is designed to focusing on, oh no, that's the same thing. And then Yvette can talk about how we got our goals.
So our goals were just established from the focus areas in the health piece, but then in regards to our data, African American women living in the rural South are greatly impacted by HIV, according to CDC 2014. So our data is old. 1.4 million adults and adolescents in the U.S. are living with HIV. And we have a study conducted by Reeve, Wilson, and Gall. The study was conducted in 2008. The article was produced in 2012, highlighting an increase in HIV in rural communities, including several southern states, and Mississippi and all other states was included in there. And then we also have a stats from the Center for the Disease and Control in 2013, Disease Control and Prevention, highlighting 89% of new HIV cases that are amongst African American women are transmitted via heterosexual relationships.
Yes. All right. Good job. Look at you.
Oh, I'm sorry. One more piece, mental health. Part of piece to tie it in. Mental health disorders play a critical role in HIV across various populations and increasing the risk of HIV due to the disparity of mental health services.
Good job. Very good job. And that's the end, because you're proving your case that not only do they have HIV, but mental health is also an issue. So you've established your need. Very good. I'm very proud of you all. Look at you. Yeah, you jumped on in there, you put something on paper. The hardest part about grant writing can be started. And literally that means writing something down. You'll read and research and read yourself to sleep, but it does, until you put something on paper, the grant writing has not started. Put something on paper and just keep going. It would improve itself as you go on. All right, so we have our needs statement and we have gotten through right here at lunchtime. So we are going to take a lunch break so our blood sugar doesn't go low and then we can continue to think and be productive. So we're going to take let's say an hour. So let's come back at 12:50. All right, we're going to get started. And we are moving into our next section, which is going to be the approach. And in all of your applications that you're going to submit, the approach is going to be the absolute most important section that you're going to have, because this is going to tell people actually what you want to do. But in order to do that, there's some things and some processes that you need to follow. And this is in any proposal. So we're going to look at pretty much the overall scope of the scope and what components need to be included. So the approach is basically a plan of action for how you propose to achieve what you want to do and why this approach is going to be most effective. You discuss how it's different from complementary or to other similar efforts by others, or it could be other similar efforts by you. Describe the expected outcomes, goals, objectives to be achieved through the project. And it may also describe specific personnel who would do the work, their qualifications, and their duties. Now, when it comes down to the personnel, that may seem like a small thing, but in all honesty, always pay attention to that, because that tells the funder who's going to run the project. And there are times when they can look at just your credentials that you have for the people working on the project, and they can glean that you know what you're going to do, that you understand what you're going to do. There are times when you may have someone who works in an organization that may be popular with the funder. And that's why you have to know who your funders are. So if it's someone whose name resonates with the funders, then you make sure you want to put that person's name in the grant, because that's going to make them say, okay, they know what they're doing. In my world, Dr. Leandro Mena was my medical director for years. And Dr. Mena is super popular. He is like the guru of HIV and STDs. And so whenever I have a grant opportunity dealing with those topics, I felt really privileged to be able to put him as the medical director. So much so now, he can't be my medical director now because he's moved on to CDC and he's over STDs. So again, he already had that influence with that group that it made things a little bit more simpler for me. So we're going to write out what we're going to do. And a couple of areas that we have to hit. First, you have to know the goal of your project. So you've talked about what the needs are. You know that people have HIV. You know that they're impacted. You know that they're dying from HIV, that it hits every group from 13 on up to 50. So you have your population, you know they're impacted. But now you have to figure out what you're going to do. Even if you're working with mental health, if you're working with sex education workers, you have to have a goal for your project. And so I have a sample goal here. A goal is a broad description of the intended results of the project. A broad description. Do not narrow your goal. We all have goals in life. You may have a goal to be, I don't know, in this day and age, to be the president of the United States. It can happen for all of us at this point. But that's the goal. There's some steps that you have to go through to accomplish that goal. In this particular instance, the goal that we're going to give for the sample is to assist public health workers in building their capacity to identify and obtain new grant funding. Now, this is a broad statement. I'm sure if you all read this and look at this, there are multiple ways to accomplish this. You can do trainings, you can have them read books, you can assign mentors, you can do coaching. There are multiple ways to accomplish this goal. And so this is where our projects start to change. This is how they start to shift. When you have the funder who's giving you what they want you to do, but every organization, each person comes up with a different way to get it done. And how you're going to get it done boils down to your outcome objectives and your process objectives. So again, your goal is going to be that broad statement of what you want to do. Then you get into how you're going to get it done. So objectives are what you want to accomplish, when the anticipated change would occur as a result of your project. Objectives are measurable, tangible, time-specific, achievable in the time within the grant is awarded and when it ends. Now, when we talked about this in the very beginning, I asked you, what's the performance period? What's the performance period? When you write your objectives, they should be within the performance period. So that tells us a couple of things. First, that tells them that you paid attention to the grant application, when it begins and when it ends. It also tells you that you can't write objectives before or after your performance period. So if you have a 3-year grant, you shouldn't write objectives for 5 years. If you have a 1-year grant, don't pick objectives that are going to take you 3 years to do them. If you work at an institution where you're going to be limited on your start date, where you're going to have a lot of red tape, and particularly working in state institutions, don't write objectives that you can't accomplish sooner. You have to do it based on how your work environment is, based on your access to the community, access to the population. So again, if it's a 3-year grant, you're writing 3-year objectives. You're not going to write 5-year objectives. So we have 2 different types of objectives. The first one is outcome, and pay attention to the words on this. Outcome is exactly what it says it is. It is the outcomes that you want to see. But outcomes don't necessarily mean how many people show up. Outcomes are a little different. Outcomes are going to be statements about the amount of behavior or knowledge change that you expect in any given health condition within a given population within a time frame. They usually measure morbidity, mortality, disabilities, levels of health conditions, behavior measures, and they have specific and have measurable results. So your outcome statements only measure knowledge and behavior change. They do not measure processes. So with our goal, which was to increase the capacity of public health workers to be able to get grants, you have to figure out what are you going to change knowledge-wise? What are you going to change behavior-wise? And so you write that outcome objective to say, hey, we're going to focus on this for behavior. And so when you write your outcome objectives, you have to include who, which is going to be your target population, how much of a change you expect. So a how much statement tells you that it's percentages. It's not going to be numbers that you count. How much is always going to be percentages. You also have what the activity that they're going to conduct, when it's going to happen. So if you're looking to do a behavior change versus a knowledge change, you know you have different time limits on behavior versus knowledge. Where you can increase knowledge in one class with a pre and post test, you can't necessarily decrease sexual risk behaviors in the class. So that's a behavior, sexual risk behaviors. Knowledge, that's, seeing if you understand the difference between HIV and AIDS, that's knowledge based. You can prove that. So ensure that when you're doing your outcome objectives, again, you're measuring knowledge and behavior change, that you make sure that it can be done within the time frame of the grant. You also talk about where and your measurement tool. How do you know that you have changed that person's behavior? How do you know that you've changed that person's knowledge? Whether you increase or decrease, you have to have something that measures that. So what an outcome objective typically reads, and they generally start the way that it starts, by the end of the year or by the end of the project, but it's usually by the end of something, to increase knowledge of the grant writing process among 50 participants by 60% who participate in the MSPHID training as measured by pre-test assessments. So you got what we're going to do, you know who we're going to do it with, you know the percentage of change, and we're going to use pre-post test assessments to see if there was actually a knowledge change. Now there's some alternatives you can use for this. You don't have to measure it with pre and post tests. You can measure by successful grant applications. I mean, mind you, if you take this class and then we monitored you and we followed you for the next 2 years to see if you actually submitted grant applications, we could measure and say that based on the individuals who went through this class, this amount were able to submit grant applications. You could also say people who were approved, because again, submission is one thing, but being approved is something completely different. So there are multiple ways that you can measure if you actually were able to impact the knowledge and behavior change of that individual. The next objective that we're going to talk about is going to be process objectives. And again, it's just what it sounds like, process, the process for doing something. If the goal is to feed your family and the behavior change and knowledge change is to understand how to shop in the supermarket, the process for understanding how to shop in the supermarket can be reading. It can be talking to others. It can be taking trips to the supermarket. So it's going to be the actual step-by-step process that it takes you to get to the outcome objective. So process objectives are statements that measure the amount of change expected in the performance and utilization of interventions that impact the outcome. They're usually short-term, realistic, and measurable. They define what you would do or what you're currently doing. So process objectives are going to say who, again, very similar to outcome, where you have the target population. They talk about how the activities will be conducted. They talk about what activities will be conducted, when they'll be conducted, what's the time frame to expect for the change to occur, the location that's going to be conducted, and again, not how much. How much is percentages? How many? That's like counting. How many apples do you have? It indicates how many activities will be conducted. So again, the biggest difference between these two objectives is that one is going to count apples and one is going to count how much of a percentage of increase that you have in apples. So an example of a process objective will be to conduct 3 grant writing trainings per year with 50 participants. Now I can do this multiple ways. I don't have to do a grant writing training. I could do webinars. I could take them to conferences. I could do one-on-one TA with someone, coaching. So to get to the ultimate outcome objective. So are there any questions about writing goals, process, and outcome objectives? All right. Well, you have another attachment that was emailed to you, and it's going to be called, I think it's called the middle. And the middle is going to be the slides that reference how to write outcome and process objectives. So pull that up, and then we're going to go into our groups, and you're going to start on writing your actual program out, indicating what your process and outcome objectives are going to be. So any questions? All right, so you have your activities. Go back into your RFP, look again, make sure you know exactly which one you're going to do, and let's get going. All right, we are back. You all seem to have had an awesome time writing and putting all this on paper, but it doesn't end there. We're going to, instead of reporting out on this section, we're going to move straight to the evaluation. So the evaluation section can help tighten up and hone in your approach. So let me share my screen. Do I have everybody? I think so. All right. So evaluation, again, with every proposal that you're putting together, you're going to submit, there's going to be an evaluation section. Why do you think that there's always going to be an evaluation section?
Because they have to make sure that you're doing what you say you're doing and
Yes.
And how you're gonna measure
their money where you say you're spending it.
Yeah, man, somebody has to be accountable for this money. So you have to keep documentation, because, you know, what they say, if it's not written, it didn't happen. So it doesn't happen if you don't have any proof that you saw someone, that you decrease the behavior, increase knowledge. It doesn't, if you just saying it means absolutely nothing. Evaluation is also how they ensure that more money comes about. You know, they can say that you did the program, but if they can prove to Congress, if they can prove to the trustees at these foundations that these programs actually work, then they're more likely to continue to fund it. Now, there are multiple types of evaluation, but we pretty much deal with 4 when we talk about the types of grants that we're going to write. So the first one is going to be formative evaluation. So evaluation, again, it's the details by the means by which the applicant and the funding source will know that the project has been accomplished. It should describe the questions to be asked, the methods to be used in gathering and analyzing the data, and how the information will be used and reported. Most government sources require logic models and outcome-based evaluation. And again, there's that word outcome again. So when we talk about the outcome objectives, and when we talk about how they're going to be measured, all of that information has to pour directly into your evaluation. And you shouldn't get to the very end and start thinking about evaluation. If you plan to do pre and post tests, that means you have to actually do the test while they're in the class, or do the test before they come to the class. You can't let them leave and decide you want to do pre and post tests, because again, just with the nature of the words, it's over with. They're gone. So you did not gauge their knowledge before they came into the class. So you can't gauge their knowledge after. So when you're doing the evaluation, first you have to know what you're going to evaluate, which is why it's so important to put that measurable piece in your objective. Determine what information is needed and how to collect it. If you have to collect gender, if you have to collect status, if you have to collect race, you have to know what you're trying to prove. Most of you all have, based on this grant, are going to be working with somebody that's African American, whether it's men, women, gay, bisexual. How do you capture race? You have to decide how you're going to analyze and report the data. Data can be analyzed in multiple ways to prove what happened. But for pre and post tests, you pretty much want to prove that there was some level of increase in knowledge. You also could do behavior. You could also do observations. So if you want to ensure that the kids or that men or that women can actually put condoms on, then you can observe them putting condoms on and you can document that process. And so identify the resources that you're going to use in evaluation. So one of the pieces of evaluation that we do is going to be formative. This is when we get into those focus groups and the piloting. And it's, again, the words say what they're going to do. Formative, the formation of, the development of your project includes formative evaluation. And so you should do focus groups. Mind you, when we write these beautiful grants, we're writing them most of the time from our pretty much our own point of view. We get some input from the community. We get some input from the people that we're going to work with. But when you submit the grant, let's say November 2021, you may not get funded until October 2022. What typically happens to people in a year? They change. Everything that you have written was for a year ago. I mean, imagine if you wrote a grant in 2019 that was funded in 2020. We all remember what happened in 2020. Everything changed. So basically, nothing that you wrote in 2020 will really be relative to 2021 because COVID changed everything. If you had projects, if you had programs you were working on, you either went virtual, you couldn't have access to people, everything started to change. So always be cognizant of the fact that when you write it, it's not indicative of when you're going to get it. And the communities that we work with, they're not stagnant. They're going to change. Then we have process monitoring. And process monitoring goes along with your process objective. Process monitoring collects data describing the characteristics of the population served, the services provided, and the resources used to deliver those services. So when we start talking about process objectives, mind you, we were just counting activities. But in here, we're going to count activities for who we're going to work with. So you have to have the people around you that you wrote into the grant. If you said you work with African-American women, you have to have that information, but you have to monitor that. You have to have tools that help you to say, hey, I work with African-American women. What are some tools that you can use to keep up with who comes to your classes?
Attendance, a sign-in sheet.
Sign-in sheet, attendance. For those of us who work in healthcare, what do you have at your facilities that you can keep up with characteristics of the population?
The registration.
Demographic forms is what we use, data forms.
Mm-hmm. Has behavioral health moved into the EHR yet?
We're in
electronic health records.
We're getting there.
Okay.
We have one here in our office.
Yes. So electronic health record systems can help you keep up with who comes into your clinic. In particular, those of you who have projects where you want to provide them with mental health therapy, the great way to be able to do is run a report out of your EHR. Then your process evaluation collects more detailed information about how the intervention was delivered and the differences between the intended population and the population served. And that you have to know the difference. What you intended to do and who actually showed up, the funders want to know that. If you said you were going to work with African-American women, but all your sign-in sheets say African-American men, that may be a problem for you. Now, the thing is, it happens. You may have this idea of this is the target population you're going to work with, but when a year goes by, that population has changed, they've relocated, or in this particular case with COVID, the emphasis changed. Who was affected by it may have changed. You know, with HIV in particular, it impacts that person's body differently. And so they age differently, gonna make a lot of differences. But when we start thinking about how COVID impacted us, if you had HIV, you may have been more likely to be susceptible to COVID. And then there's differences between men and women in HIV and how it impacts their bodies. So things may change, but those are things that you have to keep up with now. Don't get to the end of the year and decide that it changed and you didn't notify anyone. And then we have outcome monitoring. It collects data about the client's outcomes before and after the intervention. Here again, we're going back to those outcomes. You have to have a measuring tool in place to be able to understand what their knowledge was before, what their behavior was before, skills before, behaviors before, and then what is it after you complete your intervention. And you want to be able to tell the funders, did you get the expected outcomes? If you want to increase access to mental health services, at the end of the year, did more people show up? If you want to ensure that that kids understand how not to become infected with HIV, did anyone become infected? And so you have to look at those end goal things to see if what you want to do, if it actually worked. So we're going to go back into our groups again. And building on the programs that you all currently have, we're going to move to the evaluation questions. You all look so excited. You should see your faces. Or is it just me who's excited? I don't know. I mean, Patrice, you look like, oh, I have to go back again. Yes, you have to go back in. I want you all to do this whole synopsis because I got a real treat for you once you finish this section. Really good treat. But go back into your form and based on the program that you all have designed, fill in the information on your evaluation. Now, with the form that you have, I want to say that the organizational profile may be the next section, but skip that and go to the evaluation section where you're going to discuss how will the evaluation be conducted, who will collect the information, the methods that we use, and how frequently you would collect data. So again, based on the programs that you all have written, answer those questions, and then we will come back. So I'm gonna give you about 15 minutes to get that done, and I'll be in to check on you momentarily. All right, we're all back. So we are going to report out. And let's start with group one, which was Belinda's group. So tell me about your program. Tell me who you're going to work with, and then go into evaluation. But I want to do a little something different with this one. Turn to page 4 in your RFP. Okay, page 4, the structure of the proposal criteria. So this is how you're actually graded on your proposal. So they have each of the categories that we have been going through, and they give you a set of questions and they tell you how much points you're going to get. So for the core concept, that's 40% of your 100% is going to be from that section. With the organizational capacity, 25% comes from that section. Evaluation, 25%, and the budget is 10%. So I want you to report on your project based on your core and your evaluation. And I want you to first read this. And when you finish reporting out, I want you to tell me if you think that you got the points. Yeah. I'm ready when you all are. Yeah. So yeah, read it right quick and say, yeah, we did. I mean, you don't have time to go change anything because your grant has been submitted at this point. It's submitted. You can't go back on it. So now read the evaluation. Then I want you to report back on your program and tell me how many points you think you got from each section.
Had a awesome team. Just overall, we did not get all the points because for one thing, June, I was trying to follow your PowerPoint and I did not go to this page and look at that. And, just on the last one we were looking for evaluation criteria. And I said, we should have been doing this all along, but I didn't say it out loud. But we did not get all the points because we weren't specific. We were very general in talking because everybody works kind of in a different area and write different types of grants. But
And I'm gonna tell you why I didn't pull this out. If you notice, the questions that you all have been completing do not really look like this. They're a little different.
mhm.
This is how it's going to be in practically every application that you have. They're going to give you the very front end of the proposal. They're going to tell you what they want to see, what they think should go on. They're going to tell you about the populations, their goals, their whole purpose. And then they give you those questions I gave you. Now, those are their questions. Those are the questions that they want you to answer. But then you're going to be graded on this. And they're not the same. So how do you think you combat this?
We need to follow this guideline.
Mhm.
That's what we need to do.
Yes.
Because it was a little confusing and we were trying to explain we were going by the PowerPoint. So what we should have done was go to this, but those
Well,
were
Well, no, you can't go just by that. The questions that you have, those are the actual questions that you have to answer.
mm-hmm.
You have to answer those questions. 100% answer them, but they have to be answered with this in mind. But again, it's so different that if you answer the questions in their entirety, then you should be able to get these points. But again, they do not look the same and they're never going to look the same. They're always going to look different. Because what they're wanting you to really pull out, what they really want you to emphasize, that's what's on this page. So if you write from this page, you're going to miss the other components and pieces that they have. See, this page, they really want to know what your objectives are. And they want to make sure that you know what program you're going to write for. So that's what they're really going to be looking for. But you have to write it based on the questions that they give you. So, Melinda, tell me about your program and how you're going to evaluate it.
Okay, this program, we didn't really give it a title, but our goal was to establish innovative HIV programs for African-American, gay, and bisexual men to boost their confidence and to address gaps in HIV care. That was our goal.
Mhm.
Our target population, again, are African-American, gay, bisexual men. So now you want me to go to the formative that we just did or the whole
Yeah,
thing?
give me the objectives. Mhm.
Actually, Amber wrote it down. I didn't write it down. Amber, you mind chiming in?
Okay. I gotta get back. That's what I was about to say. It would have been easier for me trying to do this from home, which I was telling Melinda, if I had been able to have these resources printed out ahead of time or known that they, so I could look at all of it at one time, because I was going back and forth between a phone and a laptop. So, all right, our objectives that we had for our program were, one of them was going to be holding the listening sessions. And we said that we would do one every quarter, which would be a total of 4 for the year.
Okay.
Reducing isolation through holding social events.
Mhm.
And we had identified that we would do 2 of those by the end of the year, and to enhance the community and involvement, community support. And that was going to be through either, MOUs / partnerships, and that we would create or engage 5 of those by the end of the year.
Okay.
And we also had the strengthening of the leadership and support through hiring what we called peer support, people living with HIV. And we were going to hire at least 3 by the end of the year.
Oh, so what didn't you get?
What you mean? What didn't we get?
Yeah, what did you miss on the, you didn't miss anything. You gave me the goals, the core activities, and who you're going to work with. This is what they're grading you on.
Yes.
So this is what you have to remember. This is what they want to see. They're not going to ask a whole lot of questions, but what they really want to see is if you have your goals and your objectives right. So you did it.
Yes,
Yeah.
we did, but you know, when we got to the evaluation part,
Mhm.
we're looking to see, you know, like again, on page 4, it just says evaluation has one little statement there. We were looking for what they wanted in evaluations, but we
Now they-
came up with some activities or measures.
Yeah, now what they wanted was exactly what they asked. Evaluation, though, is in everyone. It's not always weighted the same, but that's what they want to know, how you were going to collect your data. Those are exact questions. And on here, they want to know, did you explain how it's going to be evaluated? So if you went through and answered those questions, then you basically explained how it was going to be evaluated. That's it. You are so your evaluation piece, what do you have on that?
Amber wrote it down. She was our note taker.
I do have it down. If you can help me out with the questions to make sure I've got it in order. What was the first question? 'Cause I don't-
Documents, let me go back to that page.
What is the first question?
For evaluation.
Oh, how will the evaluation be conducted?
Yes.
Well, okay, first, I mean, it's going to be conducted by the listening sessions. All those objectives that we just said, and being able to measure those success of our outcomes, were we able to do the 4 listening sessions? Were we able to do the 2 social events, the 5 MOUs, and hiring the 3 peer support? So it's conducted by the objectives that we were going to do and whether or not we met those goals and objectives or not.
Okay, so in this section, you would typically write about if you're going to use quantitative or qualitative data collection, basically. So that's how you kind of frame that language up on how you're going to do the evaluation. You also could do a mixed method evaluation. So it just depends on what you're going to use, what you're going to be looking at, what's going to lead your evaluation. For most of us, quantitative leads our evaluation. We have those surveys, we have assessments, we got the pre and post test. It's going to be mostly, quantitative. Now, qualitative gets in there when we start doing focus groups, but that's not really a heavy piece. So for the most point, it's going to be that whole quantitative piece on how we're going to collect it.
Ours will be mixed. Ours will be mixed, qualitative and quantitative. We just did not label it as such.
Awesome. Yes. Great. Mm-hmm. Okay, so the next question was, what information, who would collect the information?
All staff working with the target population.
Okay, very good. All right, next question.
What? Because I don't think I didn't write it in order.
What methods will you use?
Through the data collection would be involving the pre and post test, using our electronic health records, which have demographics, sign-in sheets for like the listening sessions or focus groups as such. And then, of course, like, secondary data that would be coming from different statistics and things. And we would also have a targeted population do evaluations of the program.
Okay, at the end, the conclusion. And how often will you collect data?
Every day.
That's right. You're going to collect every day on something because they're going to something. Yes. So depending on what you're having, if you're having daily sessions, then yes, you will collect information every day. If you are trying to gauge some knowledge change or behavior decrease, you can put that on a 3, 6, 9 month schedule or 3, 6, 12 month. Because again, if you have a 3-year program, you need more time to see the behavior change in them. Knowledge change, you can catch that in one training. Behavior change may take a little longer. All right, very good, very good. So did you all talk about sustainability? Did y'all get that far?
No, we did not get that far.
Yeah, this is, but how would you sustain a program like this?
I mean, really, to me, it would be sustainability would be, the more the listening sessions and the more things that you're doing in the community and the more involvement you have in the spreading the word of having more people want to come to that program, more people wanting to gain that confidence of sharing their story so that more people can receive services and care. So it's based off your participant, how well your program is, and if your participants are liking the program and enjoying it and doing good in it, then they want to continue to help you spread the word and have more people involved in it so that you can be sustainable and successful.
And I like that point of view on that, but I'm gonna switch it up a little bit for you. What they want to know is how you're not going to ask them for any more money. And so you still say exactly what you just said and say you're going to develop a program that sounds just like that, and you're going to shop it to other funders. So because you got to give them what the program is. And then you say you're going to look at, you may go federal, you may go state, you may go other foundations, but you're going to look for money from other foundations. That's one way. Also, do you think any of your services are billable?
Absolutely.
Yes, you put that in there too and say this fabulous program is so fabulous that we'll also be able to get money from this institute, but because we're looking at medical services, they can be billed. And so you're going to have patient revenue to support the program, and they're going to think that's awesome. Yeah, because they're always looking to see how they don't have to give you any more money. Now, and that's what should happen. When you do programs like this, you should be looking for ways to sustain it beyond this grant money. And if you do a good job, just like you said, if you get people involved in it, people actually want the program, you can find others who will actually give you money for the program. Plus, the services are going to be billable. And so you'll be able to recoup money that way too. So don't be afraid to tell them all the ways in which you know how great the program is and how you know you'll be able to get other money from someone else. All right, very good. All right, let's go to Patrice's group.
Okay, our goal is to educate middle school students, grades 6 through 8, on the acquisition and transmission of HIV/AIDS. And that's our goal. Okay.
All right.
So the outcome objective is to increase the students' knowledge of acquisition and transmission of HIV/AIDS by 40%. To do this, we'll be providing mini camps, individual sessions at existing camps, and pre and post tests will be given.
Mm-hmm.
The process objective is to conduct 3 trainings on the acquisition and transmission of HIV/AIDS during the project period with at least 45 participants. What is this? Well, it will take place through camps, individual sessions, again, including pre and post tests. And those are the objectives. And what else do you want to know?
Well,
the
let's go back.
evaluation part.
Yeah, give me the evaluation piece.
Okay, so the evaluation. The first question here, how will the evaluation be conducted? It will consist of pre and post tests, and in person with a board game with questions that they should be able to answer, and also define words. And when I say board game, it's not on the table. It'll be a large board on the wall that we make and put information up there, and they get to choose a number, and we uncover that. And that's what they'll be faced with to answer a question or tell us the definition of a word.
Mhm.
All right, then who will who will you collect information from? And that would be our student participants, the 6th through 8th grade children. What methods will be used to collect information about project progress and outcomes? The pre and post test, along with the game that they'll play
Mhm.
at that last session. How frequently will you collect data? That would be done through sign-in sheets at each session and pop-up questions for a prize.
Okay. All right. Let's go back to that lengthy outcome objective that you have.
Okay,
Read it to me one more time.
is to increase the student's knowledge of acquisition and transmission of HIV/AIDS by 40%. And we'll be providing mini camps.
Period. Period.
Pardon me?
Period. That was it.
Oh,
Yes. So don't cross up your outcomes with your processes. Your
Okay.
outcome only measures knowledge and behavior change. Once you finish measuring knowledge and behavior change and you give how you're going to do it. Now, how are you going to measure that? The knowledge you're going to do, would you say pre and post test?
pre and post test and the game.
Okay,
Or
so,
should-
okay, but that's two separate things that you have going.
Separate.
Yes, so the pre and post test should be the very end of that sentence as measured by pre and post test. Now, the game is going to be observational. So you can actually put it at the end and say you're going to do it through observational methods. You wouldn't call
Okay.
it the board game. You would call it
Okay.
observational because there's more than one way to observe. You can do
Okay.
ethnography, you can do different things on observations. So when you get to your process, that's when you would talk about the board games. You're going to do the board games with them.
Okay,
Got me? Okay. Now on the eval, you were going good, but the who is going to collect is going to be your staff, your evaluator. Those
Okay.
are the people who collect the information and they're collected from the kids. Now, the last one on the frequency is how often you're going to do it. Are you going to do it daily? Are you going to do it every 3 months, every 6 months, 12 months, whatever it may be? That's how often you're going to collect that data. So you have to be able to tell them who's going to do it and how
Okay.
often you're going to do it. And why is that's important? You really have to keep up with it because at the end of 3 months, you need to go back in and talk with the participants and get that information, see if they're either maintaining that knowledge,
Mhm.
if they're using that knowledge to see if your program actually worked.
Okay.
Okay, all right, good deal, good deal. I'm gonna, yeah, you got some of that core together. You told how you're gonna do it. Did you have anything on sustainability?
Sustainability, is this
I don't
project,
think-
okay, we are entirely new projects. It will be
Okay.
an entirely new project.
Okay, so again, the same thing, Amber. You talk up your program, how beautiful your program is, and then you talk about where else you can get monies from. Now, just like you had to learn about VIV, what type of organization VIV is, there are other organizations that support kids. There are other organizations that work with HIV. You find those other organizations and you can name them in your grant, like Elton John. Elton John Foundation supports it. You also have CDC funding that supports it. So even if you can name where you would go next to look for funding, that helps your application because now you're thinking about it. You're thinking about what to do next. And most people who provide grant funding, they want you to sustain it without their money. So they're forcing you to start thinking about that now. Who else will fund this? All right, good job.
On our answer for that question, we said seek funding from other agencies and fundraising.
Awesome. Fundraising is a good one. Yes. Yes, most definitely. Okay, good job. Let's go to the last group. Toya, Yvette.
I'm here. Okay. I think Yvette is with the client. All right, so our program is Healthy You will assist African American women 18 and over living with HIV in rural Mississippi to improve access to mental health services and to learn how to cope with HIV diagnosis. The participants will be referred to the Healthy You program by receiving information, will be referred, period. Within the organization, participants will receive therapy to deal with depression and anxiety. They'll have the Healthy You program will have trained psychiatrists who will treat mental health problems with various therapies like talk therapy and by prescribing medicine. They'll also be able to meet with a trained psychologist to help cope with life challenges and mental health issues with therapy, also with talk therapy, but not prescribed medicine. And then we'll also have family counselors and mental health, marriage and family health counselors to help people cope with life issues and mental health issues. There will be support groups, including mental health support groups with peers, as well as HIV support groups with peers to learn how to live with. They'll meet in a safe and supportive environment. And then, we'll go to the evaluation.
Mhm.
All right, so our evaluation will be conducted through pre and post surveys regarding mental health and medical resources in the area. We'll also have a mental health assessment will be conducted to identify depression, anxiety, and substance abuse. The Healthier You staff members will collect the information from the participants, whether it be through referral or direct contact. The methods will be used. The methods that we will use to collect the information about the project's progress and outcomes are through pre and post surveys, as well as assessments. And we will do it 3 times a year. So it'll be in the beginning, in the middle, and then the end. And that's all we got.
Okay, all right. Your evaluation is perfect. I think you're going to miss completely on your concept because you didn't identify the actual goals and the objectives.
Oh.
Yeah. So what you did, you wrote the program. You wrote the program beautifully. So I know exactly what you're going to do. But what they were grading you on are the goals and objectives. So though you still have to write the program out, you still have to have goals and objectives. And so when you and I talked earlier, I thought about what you needed to see to be able to kind of see the picture of what happens with it. So I'm going to share my screen and show you what it looks like. All right. Okay. Can everyone see my screen?
Yes.
Okay. So this is a VEEV grant that I wrote some years ago. And so basically there's the start off piece where you kind of get all your fluff in and all these things. The program approach, that's what you just gave. You gave everything that was going to happen. You gave the planning of it, the talking of it. This is the whole focus group piece with the initial planning. We talk about the recruitment, that's on the implementation end. Then you have your case managers, you got your navigators, your insurance, all these things are going to be a part of your program. And this is the piece that you work it through, they can see what you're going to do. But ultimately, this is what they want: goals and objectives. So they want your goal, they want your outcome objective, they want your second, I have 2 here, and they want your process objectives. So this is a section within itself that you have to write for every grant that you're going to work on. You got to put this in addition to this piece at the top. So you're going to do both. You're going to talk about what your program is going to do exactly, but then you're going to come back and give the goals and objectives. And most of the time, this is where your points are going to be, because they may read all of this stuff I have up here. But again, depending on how many grants I have to read as a reviewer, depending on what time I start, I may just want to look at your goals and objectives and see what you actually do. And then you have your evaluation. And so your evaluation is going to piggyback off of your goals and objectives. And we talk about the type of evaluations to be conducted, the evaluation questions you're going to have, and the sources, the feasibility of it. So this is pretty much how it looks every single time you do it. You're going to have this section separate with the goals and objectives, and in the very top should be your actual approach. And you all will be getting a copy of this. All right. All right. So any questions about the process of pulling together the needs and the objectives and just being able to pull these pieces together? What do you think was the easiest part? What do you think was the most complicated part?
Most complicated part was getting started.
Yes, that's for all of us. I don't care how long I've done this, putting pen to paper is the complicated part, which is why I would tell anyone, when you're trying to figure out how to put pen to paper, Google the question that they are asking you. You Google that question and you see what's already out there. I mean, it's not stealing if it's on the internet. You just get it. You get it and you make it your own. But there's no problem with going out there, Googling the exact question. As a matter of fact, Shatori and I were talking and we were talking about methods. Just Google it, see what the methods are. You can cut and paste that and put it in your application. All right, what else? What was the difficult piece? What was the easy piece?
For us,
Well,
I
for
thought
me,
the
I think, oh,
Oh, go ahead, Shatoya.
sorry, I was saying, for me, I think it was, the easier part was just writing it out.
Mm-hmm.
It's the hardest part for me is putting it where it's supposed to be.
Yes.
Like if you just want me to write an essay or write a story, great, I can do that. But it's the actual putting it where, like dissecting it is the issue for me.
And that could be the thing that knocks you out of the competition, because if they want it how they want it in their order. They want you to answer these questions this way. I think you had wonderful fluff. It was the fluffiest program I had seen in a while. And it was good, wonderful. Now that when I see the structure of it, I think it'll flow with you even more, because now you're the fluffer. When it's time to start writing your grant, someone needs to call Toy, say, Toy, fluff it up for me. And then call Amber and Melinda to do your objectives. So that perfect, absolute perfect. One person writes the approach piece, someone else writes the goals and objectives. All right. Yolanda, what are you going to say?
What I was saying was, when we actually finally got started within our group, the evaluation part for us was the easiest for us to go through. Once we actually, say, hey, this is what we're going to do. We knew how we wanted to evaluate it, and we was able to talk each other through that part of it. So that was the easiest part for us.
Well, good. And you can actually use that to help you remember what you didn't write in the front section. Because again, if you're talking about how often you're going to do the evaluation, then you got to make sure that you meet with them, see them. If you're going to do it 3 times a year, how do you have access to them? Are you going to see them 3 times a year? Do you have to email it out? You have to bring them back in. So the evaluation piece can help you think about pieces you may have missed in your approach. Okay. Anyone else? All right. We're going to go back to the slide. All right. So we're going to hit these last 2 sections. The organization profile. Again, this is going to be in every application that you have. And we actually had some questions around it, but people want to know who you are. They want to know what you're able to do, what your history is, what your background is. And so in your organization profile, you provide an overview of your mission, your history, your programs, and your relative experience. And that means what have I been doing for these years that relates to what the funder wants? That's all it's saying. And it's your opportunity and your time to really highlight who you are. It's kind of, it's like you have a letter of recommendation. So imagine if you have to write your own letter of recommendation. You should be able to talk about yourself wonderfully. You should be able to highlight all the things you've done. You should be able to give your story. So the same thing has to happen with your organization. You have to tell why your organization is great, but not only that, but why is your organization more suited, better at this? Why is your organization going to take this to the top? What have you done in the past that makes you so awesome that if you get this, you're going to make the funders proud. The funders are going to be happy with the work that you've done. And the organization profile shouldn't be taken lightly. That's the section that I write most of the time because I really feel like I can talk about myself pretty well. And if you can tell from here, it's 25% of the entire score. And most of the time, you're going to see the organization profile between 25 and 30%. So it's a good chunk of the grant because, again, they have to make sure that they're giving the monies to the right people. And the last section is the budget. The budget, this is the cost of the project for each year in operations and should be displayed in major line items. Major line items being your salaries, your supplies, your travel, your consultants, and then your other category. Other meaning just what it says, other. Other may include rent, may include some little things that you just doesn't fit in any other category. Itemize what's being provided by by what's being requested. Mind you, if you're writing a program for teens and you anticipate seeing 50 teens a year and you want to give them $50 each time you see them and you're going to see them 3 times a year, you have to put that in your budget. It can't be, if it is something that's going to be in kind, then you need to say that when you write it, that this will not be a cost to this program. It's already an operation. But if you have to give money away, if you have to hire someone, all of this has to be in your budget. So if you're going to see 5,000 people, but you don't have any staff, they're going to want to know how are you going to see the people. So it has to match up. So it's basically what you said you're going to do. You have to have people to be able to do it. You have to have facilities. You have to have supplies. You have to have all these things. If you're going to do the entire state, if you're going to see kids throughout the entire state of Mississippi, you need travel. You got to stay in a hotel. You got to have per diem. You got to rent a car. You have to put all of these things inside of the proposal and on the budget. There are reviewers who will go down look at your proposal and mesh it up to your budget line by line. And they will pick out what you're not prepared to do. They'll pick out if you have put too much money in one line and you didn't need it. So they're going to compare those 2 things to make sure that they're right. And I've worked on with some NIH budgets and reviews where there's one person who's really just sitting there paying attention to nothing but your budget. So make sure that when you do it, that it's real concise and that you're putting in what you plan to do in your budget. And you don't want to not include something in your budget and you get out there and you start working and you don't have the money to do it. So if you're going to go to conferences have fees. You need to put the conference fee in the budget. You need to put the airline travel and the hotel, all those things within the budget. So we talked about this when we looked at this RFP. You have to know what's allowable. If they're not going to pay for it, in particular with the federal government, if they say something is unallowable and you spend the money on it anyway, they're coming back for their money. Yes, you can give them a check or a credit card, but they want their money back. Yes. The percentage of the cost that's going to be requested. When you have staff on a budget, you have to say if they're going to be 100% or 50% or 25%. If they're spread across multiple budgets, no one can be above 100% across any budgets. So if you're 25 on 4 budgets, that's it for you. You can't be put anywhere else. Now, you may be able to get away with some of this on foundations, but with the feds, you don't know how their offices are set up. You may be getting money from mental health, you may be getting money from CDC, and you may be on the impression that the people who work on the budgets are in campuses far away. That's not the case. A lot of them are all in the same office working across branches, and they'll put your budget side by side. So if you're on one budget for 100%, then you're on another budget for 100%, someone's going to call you and ask you about that. Ask me how I know. See, learn it the hard way. Matching funds.
Dr. Gibson, just a question, like on the budgets, we've had that sometimes where people are, maybe 100%, you write a new project, the evaluator has to be on that 5th project. So you reduce the time on another one, if possible. So there's no limit. You just can't be over the 100%.
Yeah, you can't be over
Right.
100%. Yes.
Okay.
Yeah. Now, with that, the reducing of someone on a budget, the changing of the budgets when new people come in, it truly depends on who funds you if you have to let them know. Now, when you receive the award, they're going to give you all types of paperwork in the federal government in particular that says if key personnel changes or if this person changes, then you have to notify them. And most of the time is if the project director changes, you have to notify your project officer and PGO, which is the money people. You have to let them know that there's a change. Also, if you get a raise in the middle of the year and your budget has already been approved by the federal government, you cannot raise your money on that budget. You have to stick with that year. Again, we talk about performance period. They lock your budget in for that year. So you can't increase yourself on this budget once it's been locked in. So for us, for instance, we've had CDC money for years, then we got HRSA money and we had salary changes. HRSA, we could put the salary changes on because it was a new budget. CDC, they had to stay the same. So keep that in mind as monies come in and you're dealing with them, the changes and the contingencies that have to take place. And the timing is going to be key. You have an opportunity to resubmit your budgets once a year with the feds and with the state and with foundations. Once it's submitted, that's pretty much it. If there is going to be a change, you have to notify them because they will come back and ask for their money. Okay. All right, so we're going to look at 7 reasons for complete and unadulterated failure. Your application doesn't have a clear focus. If you're not certain about what you're doing, if you're writing for something that's not in your wheelhouse, you may end up using words, using terminology that doesn't fit. And if they're picking peer reviewers, meaning peer, they understand it, they know what should be in it. Mind you, when I do reviews for NIH, the section that I review is going to be the community piece. That's what they want to hear from me. I may read the entire thing, but that's not the answers they want from me. They want the community piece from me. They ask me about the HIV piece. So I understand that language. So if you're writing for something that you're not really clear on, that can be a reason for failure. Presentation is sloppy. I'm pretty anal about lines adding up and measuring up and things looking proper. When someone's reading back-to-back applications, you don't want them having to search through and try to figure out what you're saying. You don't want them having to look at, a 12 font here, 13 font here, Calibre, Times Roman numeral. If it's unattractive, it's an ugly proposal, I won't read it most of the time. You just didn't make my cut that time because I don't want to look at a product that you didn't take the time to make sure that you did proper indentions. The proposal is unsound. You're proposing to do the entire state of Mississippi with $5,000. You can't feed anyone for that. You can't do trainings for that. It's nothing you can do for that. So you may sound really great. Hey, I'm gonna propose to do this big project, but if it's not enough money, then you can't do it. Now, there are times when someone will fund you for something that's unsound, but what happens when you fail is that it messes with your reputation. So you look like you just didn't know how to do it. I've worked for a substance abuse facility that went into perinatal HIV. It was not in their wheelhouse. They got the grant, but they didn't know how to do it. And what they had proposed to do, it didn't make sense. And so in the end, it just was a slight on their reputation. The proposal has an internal focus rather than external. There is a rarity that someone's going to give you money for you to be better. They give you money for you to make others better. I've only had one grant in my entirety where someone gave me money to improve the organization. All monies filter out into the community. They typically do not filter back into your community. You're not getting money to build your staff's capacity. You're not getting money to ensure that your staff who are HIV positive can be linked to mental health care. So you have to make sure that you're pushing it out to the community. Budget problems, again, you didn't mesh up your budget with your activities. And so it looks as if you're trying to do things that you don't have enough money for, or you have the money, but you didn't put it in the right sections. Instructions weren't followed. Again, when they want that sheet I sent you, that's how they want the answers. Verbatim, just like that. You have to give them that. You can't give them any other version of it. It won't be accepted. And again, this horrible deadline being missed. You can't start late, because if you start late, it's going to be sloppy or you're just going to miss the deadline. And again, I know from past missing of deadlines, that is a horrible feeling when you have worked so hard to get something done and you aren't able to do it simply because you missed the deadline. So I want to show you, make sure it's still up, what VEVE actually looks like. So the grant that we all just worked on, I pulled the question straight from VEVE, and this is what they look like. So the question around the narrative and strategy, this is what they wanted. And so you will put this information into their system. And there are other drop boxes that you may find. So when you get an opportunity to write for foundations, make sure that you log in. Look and see what they're asking you. Because mind you, nothing that we read in this application gave us the idea that they were going to ask some of these questions. And then we get down to who you're working with. This is a whole nother segment of questions that they're asking that, again, from the application, you would not have known that this is what you want to actually complete. So it behooves you to go in, figure out what it's going to be so that you can have somebody working on these sections while you're actually writing the proposal. And these are the attachments. Again, they did not list them in the application, but here they are. You got to have an organizational budget. You got to have the budget for this, an annual report, IRS, 1099. List of board officers and directors. Again, not listed in the application, but this is what they want. And so if you wait to the very end and just have the grant written and you didn't have anyone to work on these components, you still end up missing the deadline or not getting funded because you didn't have everything together. All right. That concludes our training for today. So someone tell me anything. You all look like you're worn out. So as we wrap up, tell me something that you learned about grant writing.
To just get started, the more you, I'm not gonna say, the more you, just in looking at when we work in our groups, the more we went in trying to find the right information to answer, to complete the need statement, I think we kind of got off track. So the best thing to do is just to get started, and then it'll get better as you go.
Yes, it will. Yes. Day one is what it is, day one. Day 5, you're like a much smarter person. It's like you know so much more. You're so better, much better when you get to day 5. Okay. Anyone else?
I learned that you can go on the internet. I'm sorry, who was talking? Melinda, can go next.
Oh no, you go ahead, Margaret.
I learned that you can go on the internet because I've always been taught that if you copy something, then it's not yours and plagiarism or whatever. So I learned from grant writing that I can use their statements, that they're what they want and how they want it to answer their questions. And I can go on the internet and get information on that particular topic and use that information also.
Yes.
And I am not stealing.
You are not stealing, girl. I never steal. You only plagiarize when it is a paper that has to be submitted to a professor. We're not plagiarists. No, we do not. We are just casually using other people's words to make our words seem great. Yes. Anyone else?
So basically, take your time and not overthink things, and most importantly, follow the RFP.
Yes, most definitely. Follow the RFP. All right. Anyone else?
Don't pull out your hair.
Do not pull out the hair. I have a tendency to swirl around and have a knot by the end of it, or I pick my nails. You know, that's why I'm taking a break. I'm just picking at my nails. So yeah, you will pull your hair out with this. But I think if working, you almost became a solo grant writer by yourself, Shatoya. She lost her partner. But it's better when you have someone
Several
else.
times.
Yeah,
Lost a
yeah,
partner several
yeah.
times.
Yeah, you need someone with you to help you think through these things, to ask questions and pose like, does this sound right? Does this sound crazy? But it's good to have someone else to talk to about the grant. All
That's what
right.
I was gonna say, because I am a solo. That's what I was telling Melinda. I do all the grants by myself. So I learned that I need a team.
You need a team. And if you need to talk about that team approach more, feel free. I'm at you all's disposal, by the way. So if you're writing on a grant, you need me to help you with something, you got questions about something, feel free to reach out to me. Marsha was going to send you my information. And she's also going to send you that grant, that sample grant that I showed you, and the RFP that went along with it. So you can kind of see why we answered the questions the way that we did. Now, it's an older grant, haven't looked at it in a while, but you should be able to get the gist of everything. All right. Well, we got out of here on time, even though we started a little late. It was wonderful hanging out with you all today. You all were full of fun, and you know, your bewilderment really just kind of highlighted people are thinking about things, and that only thing you need is instructions of how to put it in order. And I enjoyed working with you all. This was really fun. It's one of the funnest class I've ever had with advanced grant writing, because it could be tiring now. This is a long day. Hopefully we're back in person one day so that we can do this all over again. And then I can show you some other things that'll help you to see the differences between the grants. So that's all I have.